Hey guys, welcome to today's video. So today's video is on the topic diseases of the external ear. So let's get started. To know the disease of the external ear, first let's try and classify them into simple terms. Disease of the external ear could be due to four main causes according to me. So the first cause could be congenital. The second could be trauma. Third one is inflammatory. And the last but not the least is due to tumors. Well, these tumors get to be both benign as well as malignant. So let's get started. So with this basic thing, let's see what are all the various congenital disorders of the external ear. So among the congenital disorders of the external ear, I can make you a very good mnemonic to make you remember it very easily. So the mnemonic is pretty simple. This song has been learned since our first grade. Actually, no, since pre-KG, right? So the mnemonic is basically A, B, C, D. So A, B, C, D stands for anotia, bad ear, cryptotia. Well, since C is the third letter of the alphabet, three examples are there for C. First is cryptotia, then is the cup ear, and the last is coloboma. Let's review all these things finally. And then D is nothing but deformities. Well, deformities can be minor deformities or can be major deformities as well. Well, apart from that, congenital disorders could be two additional things. Could be remembered with the mnemonic PM. So, PM stands for preauricular cyst, preauricular appendages. Well, cyst is one, and preauricular appendages is second one. And M stands for, very simple, microtia and macrotia, which is basically a tiny ear or a big ear. So, with this main background, we will know the next few things. So let's see each and every congenital disorders in detail. So the first one is anotia. Anotia meaning absent ear. If there's no ear, meaning the person has a face, but instead of having ears like these, the person is just like this. There is no ear. So that is called anotia. The second one is bad ear. So bad ear basically is also called the prominent or the protruding ear. So it's also called the prominent ear or the protruding ear. So here what happens is that the person is gonna have a ear, but then instead of being the normal ear, it's gonna be like protruding like a bat's ear. So that's basically a bad ear. Then comes cryptotia. Cryptotia is the other name given to a pocket ear. So a pocket ear is cryptotia. The ear is appearing as if it's folded inside over and over again. Next comes the cup ear, meaning the ear, instead of having these things, it's just normal shape like a cup. I mean, this is abnormal. It looks like a cup, right? A cup of tea. And then comes coloboma. Coloboma literally means lost tissue. So there can be this normal ear, which can be like a lost tissue, as in instead of having this big ear, there's gonna be like a part of ear which is lost and the rest of the ear is present. So that's coloboma. And then comes the deformities. Deformities could be a major deformity, it could be minor deformity. Well, the most often seen deformities are the minor deformities. Minor deformities include a satyr's ear. So satyr's ear is also called the Darwin's tubercle because most of the people think that it's due to an evolution. It's in fact called a Stahl's ear as well. And then comes the preauricular cyst or preauricular appendages. Well, preauricular cyst meaning preauricular. Pre means before And auricular means ear. So preauricular means before the ear. So there's this person's face. There's this person's face, the nose, the mouth, and then there's this beautiful eye in the mouth. Okay, I'm assuming it's beautiful. Well, then this is the ear. Okay, so in front of the ear, there is either a cyst, like a bubble like this, a cyst, or it could be a sinus. Okay, well, the cyst can sometimes rupture, leading to some discharge also coming. So that becomes a sinus. Okay, so it could be a cyst, it will rupture, it will give a discharge. So it seems to be like a sinus. And then comes these preauricular appendages. Have you ever wondered a person looking absolutely normal except for the fact that he has some extra ear present over here in his cheek near the normal ear? Well, this is pretty common. Well, we can't say it as an exact anomaly or something, but it's one of the congenital anomalies which we are looking at. So this one is called the appendage. It's a preauricular appendage, meaning a small ear which is present in front of the already present normal ear. And then comes this disorder which I already told, micro meaning small, macro meaning large. So small and large. So small ossia, ossia meaning ear, ossia meaning ear. So it's a small ear and a big ear. Well, all these congenital anomalies as a whole is gonna occur only as a result of one thing, that is failure of proper fusion of hillux. Hillux is basically like an embryological term which is in relation to the ear. So when we actually are forming, our ear itself will develop from a set of 6 circles like this. So it will migrate over and over to form the proper ear which we see. Okay, so if there is any defect in the formation of them or fusion of them, like said here, the person will develop a list of all these congenital anomalies. Okay, so that's how he ends up getting a congenital anomaly. So let's get into the next topic, which is trauma. So trauma to the external ear is going to be pretty simple, okay? Because I'm going to give you a very good mnemonic now. Okay, thumbs up. So the first mnemonic is flax. Okay, it's only FLAC, okay? So FLAC stands for frostbite, L for laceration, A for avulsion, K for keloid, and H for hematoma. So what is a frostbite? A frostbite is going to occur when you're going to expose the ear into cubes of icicles. So do you all love ice? I really love ice. So if you're gonna put the person into a very cold temperature, say if it's gonna be less than 20 degrees Celsius or so, he's gonna develop this condition called a frostbite, which literally is a trauma to the ear. And then comes laceration. Say the person actually picks up a fight. Then it's called laceration because as a result of this fight, the person is going to develop a tear in the ear. So what if the person actually gets into a fight and this is the face of them? The person, okay, that's a really ugly face. So finally, with all the sword, with his enemy's hand, it's getting... Yeah, so as I already said, because of this, this fight, the person can get very angry and just chop off the ear like this or chop it like this. So you'll be having like a ear which is lacerated or torn here. And then comes avulsion. Avulsion is basically similar to laceration, somewhat similar. But then the only difference is that there is going to be more emphasis on peeling. So there's this external ear which is having this cartilage covered by the skin. So if mainly the cartilage is going to get separated from the skin, then we call it avulsion. And for this keloid, instead of saying it as an exact trauma to the ear, it can be called as the consequence of the trauma because it occurs only in a few people. So keloid is basically a exaggerated scar formation. So what happens is that the person is okay, so he gets a ear injury, followed by which his ear heals perfectly. But what happens is that it does not healing healing does not stop here. Okay, so healing is gonna continue. Well, if there is excessive healing, then beyond, say for instance, if his injury was here, his granulation tissue is gonna be somewhat like this, and finally he's gonna develop like a keloid or a scar. This scar is gonna be really very big, which is covering an area which is more than the anticipated damage area. So that was about keloid, and then last one is the hematoma. Hematoma is basically a blood clot. Well, I have a lot to tell you about a blood clot. What a simple blood clot can do. Blood clot basically has these components RBC, FUWBC is just like the blood, but more of fibrin and platelets. So what these blood clots actually do is that they are gonna cause separation of the cartilage from the skin. More precisely, the perichondrium and the cartilage are going to be separated. Okay, so this is between symbol. Okay, my own symbol. So this is going to be separated. Okay, so there's going to be a gap in between both of them. Well, the fascinating anatomical fact is that the perichondrium is the supplier of the blood to the cartilage. So if there is a blood clot between both of them, then there is basically no contact between the perichondrium and the cartilage. So what happens is that the blood supply is going to be cut, and then there's going to be necrosis of the cartilage. Okay? So meanwhile, most of them say that avascular necrosis occur only in the head of the femur, but they may be wrong, because this is also avascular necrosis which occurs in the cartilage here, not in the bone. So that was about trauma. Trauma has 5 components which can be remembered by my superb mnemonic FLAC. FLAC stands for frostbite, laceration, avulsion, keloid, and hematoma. Frostbite is due to coldness, laceration, avulsion due to direct trauma, keloid is due to post-trauma, hematoma is a complication of literally everything. Next comes the inflammatory processes. So under inflammatory processes, what we're gonna see is the POA, that is the plan of action for inflammatory conditions of external ear, is that we would learn mainly about the perichondritis, and the second one is relapsing polychondritis, and third one is chondrodermatitis nodularis chronica helicis. So we'll leave these 2 things because they are not that important under undergrad level. This lecture mainly focuses on perichondritis under the topic inflammatory diseases of the external ear. So about the perichondritis, so any pathology we are supposed to know only 4 things: the etiology, the clinical features, the treatment, and if complications are there, we can know the complications as well. But here we are not talking about complications as such, but yeah, few complications are there. So let's get started. So what is the etiology? Etiology is that it's gonna be an infection. Well, in second year pathology, we have studied that the most common cause of inflammation is an infection. That's how perichondritis is also an itis. Itis meaning infection. This is due to an infection. I mean, itis is an inflammation, it's due to an infection. So what infection do you think it can be there? The infection is due to one organism mainly. The organism which is causing it is Pseudomonas aeruginosa. Well, in addition, there can be a mixed flora as well. What mainly is going to be Pseudomonas. Well, how does the person get the infection? The infection is often secondary to three things, which I would love calling it with a mnemonic called BLS, which is pretty easy, right? BLS stands for Basic Life Support, everybody knows that. So BLS actually stands for a blood clot, or a laceration, or a surgery where we incise. So it's basically a surgical incision. Okay, so the etiology is going to be infection secondary to either blood clot or laceration or surgical incision. And then comes the clinical features. The second thing they're supposed to know under an infection or whatever disease. Clinical features include those features of inflammation. Well, when we are in second year MBBS, we have learned that there are these 5 cardinal features of inflammation, right? We have seen there will be redness, there will be some pain, there will also be heat, there will also be loss of function, and there will be mild swelling. Well, in external ear, all these things will be there except for loss of function. Well, loss of function, the function of external ear is basically to condense the rays of sound, the waves of sound, and give it to the tympanic membrane, right? Well, that's not going to be a big problem here because the external ear is pretty big, okay? But however, the pinna feels stiff. It's going to be pretty stiff because of this inflammatory process. So we see what happens next. So the person comes with this clinical feature, we are going to diagnose them and we are going to give the treatment. Well, we just see if the treatment can be done based on early treatment or it can be a late treatment. Well, if it's an early treatment, what are we doing? And if it's a late treatment, what are we doing? So under early treatment, we use mainly medicine. So we give systemic antibiotics. Well, initially we give empirical systemic antibiotics, but okay, we mostly know that it's going to be due to Pseudomonas, so we give antibiotics according to that. But after culture and sensitivity report, that is antibiotic sensitivity testing, we would change the empirical antibiotics into targeted antibiotics. Followed by which we also give them a compression because in order to alleviate pain, so we give a compression of aluminum acetate, okay? Aluminum acetate compressions are supposed to be given. So that's how we treat early cases. Late cases require some vigorous treatment. The first one is drainage of the abscess. So obviously perichondritis, if it's going to be in the late stage, it's going to form pus and it's going to collect, so abscess is going to be there. Second, we drain the abscess and we surely have to do culture and sensitivity, just like we did here, but for late is a must. And third, we do a surgery. Well, what surgery do we do? It's a pretty simple surgery, okay? So we basically do an incision and then we remove the devitalized tissue, which is basically dead tissue. So we're gonna remove the dead tissue by a simple incision. And fourth one, we catheterize the abscess site directly and give them antibiotic drips. Based on the culture sensitivity, we give it for a period of 1 week to 10 days. So the perichondritis topic is over, so the plan of action is completed properly. So we know the etiology of it, that is Pseudomonas, how we got it, that is due to BLS. And we know the clinical features, literally all the symptoms of inflammation. And then we also know the treatment for early and late things. Well, let's see what happens if there is no treatment. If there is no treatment, okay, say hi to the ant too. Oh my god, that's a magic, ant is gone. So yeah, so the complications could also occur. The complications could be deadly. Okay, not deadly actually, but it can be an abscess, which is gonna cause AVN. Well, I'm using this term AVN because AVN is only occurring here. Well, AVN is often a term which is associated with the femur head fracture, but I would say that AVN occurs here as well. So let's see how it occurs. So basically, there is this part that is the cartilage. Cartilage is usually covered by pericardium, just like a heart is covered by pericardium, or a lung is covered by a pleura, or the intestines are covered by the peritoneum. Just like all these things, our cartilage are also covered by perichondrium. So what exactly I'm planning to tell here is that the blood supply to the cartilage is going to be derived from the perichondrium. So basically, pericardial vessels are the ones which supply the cartilage of the ear. So what happens is that if there's an abscess forming in between the cartilage and the perichondrium, what happens is that the blood supply is going to be cut. So as a result of cut blood supply, we call it avascular, right? So once the blood supply is cut, the tissue becomes dead. Well, what type of death? It's gonna undergo necrosis. It's not programmed, right? So it's never apoptosis. It's not apoptosis, it's necrosis. That's why I call it avascular necrosis. Well, avascular necrosis affects the cartilage mainly. So that's gonna be the complication which we're gonna talk about here. So there's basically, it starts as an abscess. The abscess is going to be between the cartilage and the perichondrium, which in turn causes necrosis. So this is the complication of it. Okay, so let's quickly move on to the next type of inflammation in brief. So it's RP. RP stands for relapsing polychondritis, which basically means that there is going to be recurrent attacks of many cartilage inflammation. So it's pretty much the same, but then it occurs over and over again. We are not going to mainly focus on that. And the last type, or the third type, is chondrodermatitis nodularis chronica helicis. It's written as chondrodermatitis, meaning the skin over the cartilage is going to be inflamed with nodules, because nodularis, for a long time, which is chronica, and the main organ which is, or main part of the external ear involved is the helix. So the helix is going to be involved. That's why it's called chondrodermatitis nodularis chronica helicis. So okay guys, thanks for watching my video. So please stay tuned for my next video on tumors of the external ear. Okay, thanks for watching.